Good afternoon, everyone. My name is Laura Morell, and I work in the National Center for Emerging and Zoonotic Infectious Diseases at the Centers for Disease Control and Prevention. On behalf of the One Health Office, I'm pleased to welcome you to the monthly Zoonoses and One Health Updates call on December 2nd, 2020. Next slide, please. Although the content of this webinar is directed to veterinarians, physicians, epidemiologists, and related public health professionals in federal, state, and local positions, the CDC has no control over who participates. Therefore, please exercise discretion on sensitive content and material, as confidentiality cannot be guaranteed. Today's webinar is being recorded. If you have any objections, you may disconnect now. Next slide. Today's presentations will address one or more of the following 5 objectives. Describe 2 key points from each presentation. Describe how a multi-sectoral One Health approach can be applied to the presentation topics. Identify an implication for animal and human health. Identify a One Health approach strategy for prevention, detection, or response to public health threats. And identify 2 new resources from CDC partners. Next slide. In compliance with continuing education requirements, all presenters must disclose any financial or other associations with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters, as well as any use of unlabeled products or products under investigational use. CDC, our planners, presenters, and their spouses and partners wish to disclose they have no financial interests or other relationships with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters. The Planning Committee reviewed content to ensure there is no bias. The presentations will not include any discussion of the unlabeled use of a product or a product under investigational use. CDC did not accept commercial support for this activity. Next slide. Instructions for receiving free continuing education are available at cdc.gov/onehealth/ZOHU/continuing education. The course access code is OneHealth 2020. To receive free CE for today's webcast, complete the evaluation at cdc.gov/TCE online by January 11th, 2021. A web on-demand recording of today's webinar will be posted online at cdc.gov/onehealth/zohu/2020/december.html by January 12th, 2021. To receive free CE for the web on-demand video of today's webinar, complete the evaluation at cdc.gov/TCE online by January 12th, 2023. Next slide. Before we begin today's presentations, Dr. Casey Barton-Baravesh, Director of CDC's One Health Office, will share some news and updates. You may begin.
Hi, everyone. Thanks again for joining us on today's ZOHU call. We appreciate your help in spreading the word about the ZOHU call and for you continuing to share our website link with your colleagues from human, animal, environment, and other relevant health sectors. Before our presentations today, I want to share just a few highlights from today's ZOHU call email newsletter. If you haven't yet subscribed, please use the link at the top of the main ZOHU call webpage so you can stay informed. CDC's response to the COVID-19 outbreak continues to evolve. Please check CDC's website for the latest guidance and resources, including information about pets and other animals. The CDC One Health Federal Interagency COVID-19 Coordination Group, or OFIC, continues to bring together representatives from 18 key federal agencies for regular meetings to share news, updates, publications, and guidance on the One Health aspects of COVID-19 relevant to the health of people, the environment, and animals, including companion animals, livestock, and other production animals like mink, wildlife, and zoo animals. We also have a state federal One Health call every week to talk to public health veterinarians, wildlife officials, and state animal health officials as well to ensure we're coordinating and exchanging information and responding to the One Health aspects of this pandemic. The One Health Partners COVID-19 webinar is also something available that takes place once a month to provide the latest information on the news and key updates, as well as guidance and resources for a variety of One Health partners. This webinar also gives updates on domestic and global animal cases of SARS-CoV-2 infection in the US and around the world, and talks about our One Health work in the US and the next call is scheduled on December 15th. At this time, CDC is aware of 138 confirmed cases of SARS-CoV-2 in a variety of animal species from 16 countries around the world. There's 75 cats, 52 dogs, 3 lions, 7 tigers, and 1 puma at 3 different zoos or animal exhibits in 2 countries. Also in the United States, there are 94 animals confirmed with SARS-CoV-2 infection, which makes up about 68% of the total animals confirmed globally. We're also aware of 391 mink farms with SARS-CoV-2 in animals from 10 countries with an unknown number of affected animals. There's 16 mink farms in 4 states in the United States with mink and other animals that have tested positive for SARS-CoV-2. And we want to remind everyone that guidance for farmers and veterinarians as well as government partners is available on USDA's website, and more resources will be available as well. At this time, there's no evidence that animals play a significant role in spreading SARS-CoV-2 to people. Based on the limited information available to date, the risk of animals spreading this virus to people is considered to be low. We are still learning about this virus, but it appears that it does spread from person to animal in some situations. So to help keep people and animals healthy, limit your contact with people and animals, whether pets or others, if you think you might have COVID-19 or if you tested positive for this virus. Also treat pets like you would other human family members, and don't let them interact with people outside your household. There's a lot of great work ongoing to learn more about this virus and the impact on people, animals, and our environment, and we'll continue sharing timely updates as information evolves. Next slide, please. So the University of Minnesota has released a pocket guide to antimicrobial prescribing for common small animal diseases. And also the current Emerging Infectious Diseases, or EID journal, has a new zoonotic disease theme this month, so be sure to check that out. Next slide, please. There's a 3rd new outbreak of E. coli infections of unknown sources that's been posted on CDC's website. And the next call is going to take place on February 2nd. Please email topics or suggestions for future presentations and news from your organization to zohucall@cdc.gov. And I'll turn it back over to Laura. Thanks.
Thank you. Next slide, please. You may submit questions at any time using Zoom's Q&A feature. Please include the topic or presenter's name. And the Q&A session will follow the final presentation. Next slide. Our first presentation, SARS-CoV-2 infection and seropositivity among pets of persons with laboratory confirmed SARS-CoV-2 2020, will be given by Grace Goryoka. Please begin when you're ready.
Hi everyone, I'm Grace Goryoka and I'm a public health advisor in CDC's One Health office, and I'm also on the CDC One Health working group of the COVID-19 response. I'm looking forward to sharing with you all some work that the One Health Working Group has done on SARS-CoV-2 infection and seropositivity among pets of persons with laboratory confirmed SARS-CoV-2. Next slide, please. In the United States, approximately 85 million households own at least one pet, with dogs and cats being the most popular. Human-animal interactions are associated with improved mental, social, and physiologic health, including decreased feelings of loneliness, as well as decreased blood pressure, cholesterol, and triglyceride levels. Owning pets also creates increased opportunities for exercise and outdoor activities and socialization. Additionally, human-animal interactions are critical for service and working dogs. Animals have an important role in our lives, whether they are a part of our families or we work with them. Next slide, please. At the start of the pandemic, the role of companion animals in COVID-19 transmission was unknown. For some background, I want to go back to what we knew in March of 2020. We knew that all known human coronaviruses had originated from mammalian hosts, which suggested that SARS-CoV-2 was a zoonotic pathogen that had the potential to spill over to other animals such as pets. Previous studies on SARS coronavirus back in 2003 indicated that cats were naturally infected with SARS coronavirus and that both ferrets and cats could be experimentally infected and transmit to members of the same species. We also knew that research on the receptor binding domain of SARS-CoV-2 suggested that amino acid residues in mammalian ACE2 receptors were biologically conserved in cats, ferrets, pigs, and non-human primates. This suggested that these animals had cell types that were permissive to viral entry. This information on species susceptibility highlighted the gaps in knowledge about companion animals and SARS-CoV-2. In addition, in late February, global news of the first companion animal testing positive for SARS-CoV-2 in Hong Kong was reported after having contact with a confirmed human COVID-19 case. We also saw animal welfare concerns as reports surfaced of pets being abandoned or killed due to fears around COVID-19. There was lack of information about the role of pets in the pandemic, their susceptibility, and role as hosts or fomites. We are continuing to learn more about the role of animals in the COVID-19 pandemic and are updating the link at the bottom of this slide as we learn more. In response to these concerns in March, we knew that an opportunity to conduct a One Health epidemiologic investigation would allow us to further investigate some unanswered questions. Next slide, please. So the One Health Working Group of the COVID-19 response collaborated across local, state, and federal human and animal health agencies to conduct this One Health household transmission investigation in Utah and Wisconsin. Listed on this slide are the many agencies that supported this One Health investigation. Next slide, please. CDC had already begun a human COVID-19 household transmission investigation in households with at least one person with laboratory confirmed COVID-19 infection, which was defined as a human household member who was positive by PCR on nasopharyngeal or nasal swabs or had SARS-CoV-2 antibodies detected. Results from the human component of this household transmission investigation can be found in the publication linked on this slide. The primary purpose of the One Health component of this household transmission investigation was to assess SARS-CoV-2 infections in mammalian pets residing in households with laboratory confirmed human COVID-19 cases. The results from this investigation would help inform guidance and decision-making during this pandemic and for future preparedness efforts. Next slide, please. So CDC's One Health Working Group of the COVID-19 response deployed 2 veterinary field teams to join our other CDC colleagues in Utah and Wisconsin. Any household from the ongoing CDC household transmission investigation in Utah and Wisconsin that had one or more mammalian pets living in the household was included for recruitment into this One Health component of this investigation. In the human portion of the household transmission investigation, individuals were asked about companion animals residing in their home and if their pets had developed clinical signs consistent with SARS-CoV-2 infection after the diagnosis of the COVID-19 human index case. Eligible households were then contacted over the phone to collect information for pet enrollment. Pets were enrolled into this investigation if the owner consented, a questionnaire was completed by a household member, and at least one sample was collected from each pet. Next slide, please. Once a household pet was enrolled, CDC field teams administered a questionnaire to the household members for each pet to capture information on the pet's signalment, medical history, and the household member's knowledge of public health recommendations. We also asked about any clinical signs in the pets since onset of illness of the first human household case, and asked about the duration of interaction the index case had with their pets and types of interactions like petting and cuddling, and what types of community interactions their pets had. The questionnaire also asked about the household and personal precautionary measures taken since the human index case's diagnosis. Next slide, please. Our CDC field teams were also prepared to answer questions that households may have had about animals and SARS-CoV-2. Additionally, at the end of each household visit, households were given an educational information sheet on animals and SARS-CoV-2. This information sheet provided answers to questions like, how long will it take to get the results and how will I be notified? What do I do if my pet tests positive for the virus? Who should I contact if I have any questions about my pet during the study? We also provided additional information on how to stay healthy around animals and links to our CDC web pages for more information. Next slide, please. For this One Health investigation, the samples to be collected from pets were oropharyngeal, nasal, rectal, and fur swabs, and fecal and blood samples. All samples were sent to the Wisconsin Veterinary Diagnostic Laboratory, WVDL, and preliminary RNA extraction and real-time quantitative PCR testing of animal specimens occurred at WVDL. If a specimen was PCR positive at WVDL, it was considered to be presumptive positive and sent to USDA's National Veterinary Services Laboratories, NVSL, which is the National Animal Reference Laboratory for confirmatory testing of SARS-CoV-2. NVSL would also attempt sequencing and viral isolation. Blood samples were received and processed at WVDL, and the sera was sent to NVSL for testing by a SARS-CoV-2 virus neutralization assay. We based our initial sample collection on guidance from the World Organization for Animal Health. In addition, we collected fecal samples from a subset of animals to assess the relative sensitivities for rectal swabs versus fecal samples. This is of interest to us for animal welfare considerations since fecal sample collection is not invasive and less stressful for the animal. Next slide, please. Now I'll present some information on our enrollment. Of the 62 households enrolled into CDC's household transmission investigation, 41 of those households had pets. From these, we were able to enroll 56 pets, which included 37 dogs and 19 cats from 34 households in Utah and Wisconsin. We collected oral and fur swabs from each pet and nasal and rectal swabs from nearly all animals. We collected blood samples from 47 of the 56 pets and fecal samples from 14 animals. If the animal became uncomfortable or fractious, sample collection was stopped. Next slide, please. Now I'll present some of the findings from this One Health investigation. All oral, nasal, rectal swabs collected and the subset of fecal samples collected were all negative for SARS-CoV-2. We were able to collect blood samples from 47 of the 56 pets, and of these 47 pets, 8 pets, which were 4 dogs and 4 cats, were seropositive. The neutralizing titers for all dog samples were 1 to 32, while cat titers ranged from 1 to 32 to 1 to 128. Next slide, please. The median time from symptom onset of the household's human index case to first date of pet sampling was 27 days. We also found that the median proportion of human household members with laboratory-confirmed SARS-CoV-2 infection was 45%. We did find that the proportion of human household members with laboratory-confirmed SARS-CoV-2 was greater in households with a seropositive pet compared to households with no seropositive pet, which was statistically significant. There were generally a higher percentage of positive people in households that had a positive pet compared with households who didn't have a positive pet. Next slide, please. We also asked owners about if their pets had any clinical signs. So clinical signs that could be consistent with SARS-CoV-2 infection were reported in 14 pets from our investigation and included respiratory signs like sneezing, coughing, nasal discharge, and difficulty breathing or shortness of breath, as well as gastrointestinal signs like vomiting and diarrhea, and nonspecific signs like inappetence or lethargy. Clinical signs consistent with SARS-CoV-2 in animals are generally nonspecific and could potentially be attributed to other factors. The most commonly reported clinical signs from this investigation were respiratory, which included reports of sneezing, coughing, and nasal discharge. Among the 8 seropositive pets, owners reported that 2 seropositive dogs had mild clinical signs consistent with SARS-CoV-2. 1 dog had nasal discharge and the other had inappetence. None of the seropositive cats had clinical signs in this investigation. Among the 39 seronegative pets, 8 had clinical signs. The owners reported most pets had mild clinical signs, but 1 pet was reported to have difficulty breathing. And among the 9 pets that did not have blood samples collected, 4 pets had mild clinical signs, including sneezing, coughing, and lethargy. While 25% of the pets in this investigation were reported to have clinical signs consistent with SARS-CoV-2, no animals received veterinary treatment for those clinical signs. Our findings, in conjunction with other research, suggest that clinical signs in companion animals are a poor indicator of serostatus for SARS-CoV-2. Next slide, please. We also collected fur samples in duplicate from pets during this investigation. If the household had multiple repeat visits, all samples, including fur, were attempted for collection. Fur samples were obtained from all pets in our investigation. SARS-CoV-2 RNA detection from first samples was extremely rare. First samples from 1 of 56 pets tested positive at one time point. This dog had no evidence of infection and remained asymptomatic. All nasal, oral, and rectal swabs and stool were also negative, and this dog was also seronegative. Viral culture from the first sample was unsuccessful. Subsequent first samples from this dog were also negative. Now I would like to talk a little bit more about this specific dog's household. Next slide, please. The day the positive first sample was collected, all 6 human household members reported symptoms consistent with COVID-19. Nasopharyngeal swabs collected from 4 household members on the same day the first swab was collected tested positive by PCR. Swabs from the remaining 2 people in the household tested positive 2 days later. We worked with the Utah Department of Health for the sequences from these positive tests from the human household members. 7 near full genomes or full genomes were generated from this household. These sequences were from 4 household members and the dog's first sample. The high sequence similarity suggests one introduction from the community and subsequent internal household transmission. Our findings suggest that viral RNA on the fur was environmental contamination from the household members. Next slide, please. We had also asked household members about the interactions between the human index case and pets in these households. When looking at the duration of interaction, we found that 33 pets that had serologic testing performed had frequent daily contact with the human index case prior to diagnosis. Of those 33 pets, 14 pets had decreased contact with the human index case after diagnosis, and none of these pets were seropositive. 19 pets had stable or increased contact with the human index case after diagnosis, and 4 were seropositive. In addition to the duration of interaction collected, we also captured information on various types of interactions between the human index case and their pets in each household before and after the human index case's diagnosis. Some of these interactions included cuddling, feeding, sleeping in the same location, and taking their pets for walks. Overall, owners reported pets had fewer types of interactions with the human index case after their diagnosis. Next slide, please. We also asked households about their pets' community interactions. From the time the human index case began isolation, 29 pets spent time free roaming in the yard or in the neighborhood. 5 of these pets were seropositive. However, only one pet, an 8-year-old cat, spent greater than 50% of their time outdoors, and this cat was seropositive. 5 pets also attended a social setting, which included a dog park, daytime boarding facility, or a veterinary clinic, and all of these pets were seronegative. Next slide, please. Household members were also asked if the human index case wore any type of personal protection equipment after starting home isolation. 5 of 34 households, representing 10 pets, reported that the human index case wore face masks within their household. Of these 5 households, 2 also used gloves around pets. In households with reported face mask use, 1 pet was seropositive, while in households with no reported face mask use, 7 of 43 pets were seropositive. Next slide, please. Additionally, to better understand if our public health recommendations were reaching the public, we asked about the household's familiarity with CDC recommendations for people with suspected or confirmed COVID-19 restricting contact with pets. Of 34 households, 10 identified a household member familiar with CDC's recommendations for people with suspected or confirmed COVID-19 restricting contact with pets. Of these 10 households, 7 did not have seropositive pets. Of the households familiar with CDC's recommendations, human index cases in 2 households reduced interactions with all pets after the person's diagnosis, and human index cases in 2 households used masks and gloves while interacting with pets. It is difficult to draw conclusions from this based on the sample size, but we think it's important to present to better understand if public health recommendations are being implemented and to inform future studies. Next slide, please. This One Health household transmission investigation systematically evaluated pets residing in households with laboratory-confirmed human COVID-19 cases and suggests that human-to-animal transmission in this setting occurred more frequently than previously recognized. The results identified from this investigation further shows that transmission of SARS-CoV-2 from people to pets may occur in households, especially after contact with people with COVID-19. Our findings, taken in conjunction with other publications, suggest that human-to-animal transmission is occurring in these settings. CDC at the start of the pandemic had made recommendations to avoid animals, including pets, when sick with COVID-19. These results from our investigation continue to highlight the importance of people with suspected or confirmed COVID-19 restricting contact with pets and other animals to prevent person-to-animal transmission. For some future suggestions, future household transmission investigations should work to sample pets across the spectrum of exposure, including time points closer to the start of the household's index cases exposure window, and at multiple subsequent time points to learn more about viral shedding, symptomatology, and risk factors. We also continue to encourage that a One Health approach is used for these types of household transmission investigations. Next slide, please. Since this household transmission investigation ended, our One Health working group has also been collecting data on clinical signs of companion animals with confirmed SARS-CoV-2 infection in the United States. The data from the household transmission investigation were also incorporated into this larger database. Surveillance data is really limited, and because there have been so few cases, we are working with our state partners to gather more information about how these cases of SARS-CoV-2 in animals present to better understand and characterize clinical signs of companion animals with SARS-CoV-2 infection. Out of 77 cases of companion animals in the U.S. positive for SARS-CoV-2 infection, 57% of these pets were asymptomatic, 32% have been clinical, and 11% are unknown as reported by state partners conducting investigations into positive animals. Respiratory signs have included coughing, sneezing, nasal or ocular discharge, and nonspecific signs have included fever, lethargy, and inappetence. Gastrointestinal signs have included vomiting and diarrhea. Next slide, please. And just to wrap up with some reminders on what to do if you are sick and have animals, until we know more about this virus, it is recommended to treat pets like human family members. Don't let pets interact with people outside your household. Keep cats indoors. Do not allow them to roam freely. Walk dogs on a leash at least 6 feet from others. Avoid public places where a large number of people gather. And additionally, masks should not be put on pets. Next slide, please. And if you are sick with COVID-19, restrict contact with people and animals. When possible, have another member of your household care for your pet. Avoid contact with pets, including petting, snuggling, being kissed or licked, sharing food, or sleeping in the same bed. And if you must care for your pets, wear a mask and wash your hands before and after you interact with them. If your pet gets sick and you are sick with COVID-19, please contact your veterinarian. Next slide, please. I want to express my sincerest thank you to all of our collaborators that are listed here on this slide. And additionally, I want to thank all the participating households in the Salt Lake City and Milwaukee metropolitan areas for their interest in this investigation and willingness to involve their pets. Thank you very much.
Thank you. Next, please. Our final presentation, One Health investigation of SARS-CoV-2 on multiple mink farms in Utah, is by Dr. Caitlin Kosseboom and Dr. Dean Taylor. Take a moment to get back to the slides and then you can begin when you're ready. You can begin when you're ready.
Okay, hi everyone. My name is Caitlin Kosseboom, and I'm a veterinary epidemiologist currently supporting CDC's COVID-19 One Health Working Group. It's my pleasure to co-present today with Dr. Dean Taylor, Utah's state veterinarian, on the One Health investigation of SARS-CoV-2 on multiple mink farms in Utah. Next slide. As of December 1st, mink on 391 farms in 10 countries have been confirmed to have SARS-CoV-2 infection. The Netherlands, shown in navy blue on the graph, identified the first affected mink farm in the world and have since identified 70 total affected farms across the country. Denmark, shown in red, recently became the leading country in the world with 289 affected mink farms, with a doubling in the number of affected farms through active surveillance and testing. Just a note that the most recent countries, Lithuania was just reported to OIE today and is not listed on the graph, and Poland has not yet been reported to OIE. Next slide. On August 17, 2020, the U.S. Department of Agriculture's National Veterinary Services Laboratories confirmed that mink from 2 farms in Utah were infected with SARS-CoV-2. The United States has since identified a total of 16 affected farms, with 12 in Utah, 2 in Wisconsin, 1 in Michigan, and 1 in Oregon. CDC has been working with One Health collaborators, including local and state health departments, state departments of agriculture and natural resources, USDA, and the National Wildlife Health Center to investigate these outbreaks on multiple farms in the United States to help figure out how the virus gets on the farm, how it's transmitted between species on the farm by collecting samples from mink, people, wildlife, and other animals like dogs and cats from the farms. We're doing this to learn how to prevent future outbreaks and to get more information to help figure out what to do when this happens. Next slide. CDC is aware that Denmark has reported a new strain of SARS-CoV-2 virus in mink that's also present in the local human population. This new strain or variant, referred to as cluster 5, is defined by 5 mutations in the region of the genome coding for the spike protein. Based on the current available data, these mutations do not appear to affect how quickly the virus can spread or the severity of infection, but more research is ongoing to continue investigating if there are any implications that these mutations may have. Next slide. In response to this news, One Health partners are investigating scientific findings of Denmark's reports by conducting on-farm investigations to address SARS-CoV-2 in people and multiple animal species on mink farms in the United States, including collaboration between CDC and USDA on sequence analysis from positive mink, other animals, and people associated with affected mink farms, and generating guidance and recommendations for states and mink farmers in collaboration with partners in the US and globally. Now I will turn it over to my co-presenter, Dr. Dean Taylor, the State Veterinarian of Utah, to give some background information on the Utah mink farm investigation. Next slide.
Good afternoon. I'm Dean Taylor, the Utah State Veterinarian. It's my pleasure to share with you our response to the outbreak of SARS-CoV-2 in mink in Utah. On August 10th, the first mink were presented to the Utah Veterinary Diagnostic Lab from 2 farms who were experiencing higher than normal death losses. On August 13th, we had 3 farms affected, and by the 14th, when we sent our veterinarians down to place quarantines and collect additional mink from the additional farms, we were up to 4 farms in 2 neighboring counties there. This was because one of the farmers in the initial county also owned a separate facility in a neighboring county and shared his workers between those 2. On August 17th, we got confirmation confirming SARS-CoV-2 in the mink in the United States. And on August 19th, a One Health response began. Next slide, please. To give a history, all of these farms had histories of workers falling ill with a confirmation of COVID-19 prior to the onset of the death losses in the farms. There was an approximate 5-day lapse between when those workers were sick and when they saw the death losses start to increase. And they reached numbers of upwards of 500 per day. This number is somewhat variable depending on the farm that we spoke to, and it would average out to about 5 days for the interval. The first couple of days when these mink farmers saw these increased death losses, they were attributing these to other well-known diseases such as Pseudomonas and Aleutian's disease. It was on the referral of the attending veterinarian that dead mink were sent to Utah Veterinary Diagnostic Lab for sampling and necropsy. Next slide, please. This immediately, as soon as Utah Veterinary Diagnostic Lab suspected that we had SARS-CoV-2 in these mink, and then sent those samples to the Washington Diagnostic Lab, we immediately started getting calls and support from other agencies around the country. And a cooperative response was formed between Utah's Department of Agriculture, our health department, and other players such as the CDC, the USDA, both Wildlife Services and One Health, as well as labs involved. Next slide, please. So the plan was for the CDC and the Utah Department of Health to begin doing some testing on these farms. They looked at several different types of sampling there. First, they would take the fresh dead mink each day and test them. They also did some mortality studies where they would sacrifice animals who randomly on the farm, as well as those with any kind of clinical signs. And then they also took some live samples from a number of mink on these farms. As CDC was doing this, the Department of Health was also testing the humans on these farms to look for, to see if they had COVID-19 and to retest those who had previously tested negative. In addition to these two agencies, Wildlife Services also stepped in and began testing around the farms. They were testing all types of wildlife and also the feral mink who had escaped from these farms. Next slide, please. So after this initial round of testing was done and we got some numbers there, the team was going to return to Utah and begin testing on October 1st to see what kind of prevalence of the virus there was on those farms at that point in time. Right prior to their arrival on October 1st, a second outbreak occurred in a distant county in our state. Initially, in this second outbreak, there was no history of human COVID-19. And so our suspect fell to the feral cats that were surrounding all of these farms, as there's an abundance of them. Additionally, they were right on a river where the feral mink would set up housekeeping and live. After they came and started doing testing, they found that there were human COVID-19 cases on all of the affected farms in the second outbreak as well. We then had a third round of testing that will be coming on December 4th, started just a couple days ago, and we're going to be looking at the animals who tested positive both in August and in October and help to determine if they are persistently carrying this virus or not, or whether it's just circulating. Our concern from the October testing, which was nearly 10 weeks after the first round of testing, was that we still had an actual increased percentage that were PCR positive with fairly low CT values. Next slide, please. So one of the things that I thought I would bring up to the group is that there have been some obstacles to our response, and this industry is one that has innately has a little bit of mistrust because of the fact that they are targets oftentimes, and so they are very, very close to having any outside people come onto their farms and see their operations. The other problem that we had was that we had to come up with some compensation for mortality studies. Here in Utah, our losses approached 50% on the breeding populations of these farms. So to come in and do mortality studies for research purposes wasn't going to sit very well with these producers. So we had to find some compensation for those mortality studies before we could even begin. And then they were also holding out for compensation for their losses. They fall into a unique situation where they don't qualify for indemnity through USDA, similar to some of our other animals, such as the beef and food animals. And so they were fairly resistant to having anybody come on to their facilities. The other thing that was expressed by some of these farmers that slowed the process down initially was worker fear when they saw people in full PPE. We worked through all of these issues, and as we gained their trust with privacy concerns, they were able to allow us to come on and do that research. Next slide, please. Our current management concerns here in Utah are currently, our state is almost through with their pelting process, but our current concerns are how to do that safely and keep people safe. And one of the issues that the producers have is that we continue to tell them that our research indicates that this virus has gone from people to mink. And at the same time, we turn around and tell them you need to use this PPE at the highest level. And we're trying to get them to understand that we're still in the process of understanding this virus. And so we're going to take as many precautions as possible. So so most of these have been pelted at this point in time. And so we're also approaching the processing plants with the same advice here in Utah. Excuse me. The next thing that we have that we're worrying about is how do we dispose of things like waste and the water contamination runoff into the water tables. Many of these farms are right next to rivers, or they're out in areas where we have high water tables here in Utah. Because some of these producers have not done composting accurately, we have asked them to dispose of all carcasses through sanitary landfill that we've contracted with. Next slide, please.
So this is Caitlin again. So we know that among susceptible animal species, mink are particularly highly susceptible to SARS-CoV-2. This could be due to a combination of genetic and environmental factors. For example, farmed mink are often housed in relatively high densities where they're in close contact with one another, which favors spread of the virus. Additionally, farmed mink do not exhibit a large amount of genetic diversity, which can favor infectious disease transmission and susceptibility. Like humans, mink have exhibited symptoms that range from being asymptomatic or having mild clinical signs like being off feed and having respiratory or gastrointestinal signs to rapid death in a high percentage of animals on a given farm. Because of this, it's very important that extra precautions are taken to protect mink and humans while working on mink farms. Next slide. CDC's COVID-19 One Health Working Group has deployed field teams to support on-farm investigations in the 3 states that have had farms with mink confirmed to be infected with SARS-CoV-2. From the farms that have been affected so far, many farmers have noticed that the animals went off feed first before they showed any clinical signs of illness. In most cases, this was followed by coughing, sneezing, severe nose and eye discharge and crustiness, and profound lethargy. In the Netherlands, they also saw animals with diarrhea. The signs progressed to labored breathing and death in most of the farms in the U.S. The disease moved rapidly through the facilities both within and between barns. Farms in the U.S. typically have seen about 7 to 10 days of high mortality, followed by a period of residual sickness. Next slide. This slide shows what we know to date about the transmission of the virus on mink farms. We know that SARS-CoV-2 infection spreads most commonly from person to person. Infected people, either with symptoms or without symptoms, initially introduce the virus to the mink. Once it's initially introduced to mink in the herd, the mink spread the virus to other mink. It spreads very quickly on the farm, and we've seen losses ranging from 20 to 50% on some affected farms. Well, we're still learning about how long mink are infected with the virus and how it can spread to other animals on the farm like dogs, cats, and wildlife, including feral mink and other animals. At this time, there's not currently evidence that suggests mink to human transmission has occurred on U.S. farms. However, the investigations are ongoing. Next slide. We know that mink to human transmission is suspected to have occurred on farms in the Netherlands and Denmark. We're still learning about the potential risk of mink in their pelts to transmit virus back to people, and there's currently work ongoing to investigate these questions. CDC's COVID-19 One Health Working Group is continuing to work with state and federal partners to continue investigating and monitoring transmission of SARS-CoV-2 on mink farms in the United States. Next slide. We also wanted to make you all aware of a webinar that we recently organized, a national mink farmer training on steps to prevent SARS-CoV-2 on mink farms. The purpose of this webinar was to share information with mink producers and farm workers on what we know about the virus that causes COVID-19 in mink and people. Topics included how to protect mink and workers from this virus, steps to prevent virus introduction on the farms, included recommended biosecurity and personal protective equipment practices, and available guidance documents and resources to protect human and animal health. Next slide. Biosecurity refers to management practices that reduce the risk of disease and contamination on farms. These are some of the components of a comprehensive biosecurity plan. The Fur Commission has a biosecurity guidance document that goes into much more detail than we can cover today. The link is shown at the bottom of this slide. The highlighted recommendations for the development of a mink farm biosecurity plan are to restrict access to the premises and buildings where mink are kept, minimize visitors and other animals, rodents, birds, and wildlife on the premises, require all employees to stay home if they're sick, maintain at least 6 feet distance between all people working on the farm, and use face masks and personal protective equipment or PPE, such as dedicated footwear that can be cleaned and disinfected, dedicated farm clothing such as coveralls, gloves, and eye protection such as face shields or goggles. It's important that people on the farm wear PPE, including face masks, even if they don't feel sick. We also recommend to disinfect frequently touched surfaces, for example, door handles, counters, control panels, feed bins, and practice strict hygiene in areas where animal feed is prepared, and clean and disinfect feeding equipment daily using an EPA-approved disinfectant. Finally, we recommend to use caution when introducing new mink to the herd, including quarantining before bringing new mink into the herd. Next slide. To prevent the introduction of COVID-19 into the farm, it's critical to make sure no one who is sick works with the animals. One way to do this is to conduct daily health checks, including symptom and/or temperature screening of anyone, including family members, friends, or employees before they enter the farm. People who have symptoms upon arrival at work or who become sick during the day should immediately be sent home and should not return to work until the criteria to discontinue home isolation are met. Next slide. It's possible that the virus can be found on surfaces and equipment like tools, cages, other items in the animal area, but fortunately there's a lot of cleaners that can kill the virus. The EPA has a list of disinfectants that are effective against coronavirus at the link that's shown on this slide. And if you're at the store looking into buying disinfectants, you can check the label to see if it's effective against the coronavirus or has the EPA seal. The contact time or time the cleaner needs to be on the surface to disinfect does depend on the cleaning product, so be sure to check the label. Additionally, any equipment used on one farm should not be used on another farm, including protective clothing like coveralls and leather gloves. Next slide. Now we're going to talk about what personal protective equipment or PPE should be used on the farm. But before I do, I wanted to mention a couple important points to remember. COVID-19 cases are increasing everywhere, including among people who work on mink farms. People infected with the virus may not show symptoms, or symptoms may be mild, but they can still transmit the virus to other people or mink through breathing or talking. People are the main source of infection to each other and introduce the virus to mink farms. This virus causes high morbidity and mortality in mink. We need to protect them and ourselves with PPE to prevent introduction of the virus to the farm, stop spread to other farms, and minimize animal losses. Next slide. This is the basic everyday PPE to use even with no known exposure to COVID-19 or any symptoms, given that we know people with COVID-19 can be asymptomatic. This includes a face mask and, if available, a fit-tested respirator such as an N95, eye protection, dedicated outerwear such as coveralls, and disposable gloves or gloves that can be disinfected between use. Next slide. If mink are sick or test positive for SARS-CoV-2, to limit virus spread between barns, it's important to keep the number of people working with sick or positive mink to a minimum. This can be done by assigning certain people to work only in certain barns, caring for healthy animals before caring for sick animals, not sharing equipment or feed between barns, disposing of leftover feed, and not sharing with other animals on the farm. It's also recommended to not have staff who are higher risk for severe illness for COVID-19 work with animals suspected or confirmed to be infected with SARS-CoV-2. Additionally, anyone who has contact with or works near sick animals should wear respiratory protection, for example, an N95 respirator instead of a face mask. Next slide. In conclusion, we know that mink are very susceptible to SARS-CoV-2. Anyone who is experiencing COVID-19 symptoms or may have been exposed to COVID-19 or diagnosed with COVID-19 should not work with the mink in order to prevent introduction of the virus to the herd and to protect the mink from getting sick and dying. Next slide. Finally, we wanted to make sure you all are aware of guidance documents that were developed in collaboration between CDC, USDA, and state animal health officials in the One Health Federal Interagency Livestock Subgroup. These guidance documents can be found online at the link shown here on the screen and were developed to provide recommendations related to PPE, biosecurity, and steps to take if infection is suspected or confirmed on a mink farm. Next slide. This concludes our presentation for today. We want to thank everyone listed on this slide for making these investigations possible, including the mink producers that have been willing to work with us, all of our state partners in Utah, and federal partners with CDC's COVID-19 One Health Working Group, USDA, and the National Wildlife Health Center. Thank you all very much for your attention, and we would be happy to take any questions.
Thank you, and thanks to all of today's speakers for their informative presentations. We do have time for some questions. Please use the Q&A feature in Zoom to send your questions and include the presenter's name or topic. I'll start with some questions that we've already gotten for Grace. Can you elaborate on what it means to use a One Health approach in this specific example of infection investigations?
Yes, thanks. So a One Health approach for this investigation was used by not only looking at transmission of SARS-CoV-2 among people and like a human household transmission investigation, but also for pets in this investigation. So by incorporating this, we're looking at not only humans, but also pets or animals in the household. And then additionally, when we conducted this investigation, we were not only working in the households for these, but we were also working across many federal, state, and local human and animal health agencies and partners to be able to conduct this. So making sure you're collaborating and communicating and sharing information and results across all sectors is definitely something that goes into utilizing a One Health approach for these types of investigations.
Thank you. And another question was, do you have any information for how long the virus would remain on fur?
Sure. So virus isolation from the positive fur sample from this investigation was unsuccessful, and subsequent fur swabs were taken at various time points, and none of those were positive. And so based on the findings from this investigation, fur is not considered to be a fomite for SARS-CoV-2 transmission. And just reiterating that virus isolation was unsuccessful for this.
Great, thank you. We'll move on to some questions for the mink presenters. How many mink were on the farms reporting the mink mortalities is the first question.
So this is Dr. Taylor. The number of mink on the farms ranged from 3,000 to over 20,000 on some of them, with everything in between. So there's a fairly high range of the size of these different farms.
Thank you. And let's see, there's one, can you say more about how you went about communicating with farms to get buy-in and to coordinate compensation? What challenges, successes, and lessons learned were realized?
Sure. We had to do some creative financing through the state with some of this CARES money that had already been designated. Here in Utah, it was earmarked for specific organizations and the amount that they could get. And the mink producers in Utah had already received that money when this happened. So it took us a few weeks, but we were able to we had to have the legislature meet and approve a change in that. And then we were able to get some compensation for these losses. And that, quite honestly, is what opened up the door for us to be able to get onto these farms and continue to do the research there. They have wanted to help, but they've kind of felt like they were left out of any kind of a helping hand. So when our state came through with that, it felt like the flavor of that changed dramatically for us. And also, I will say that the professionalism of the CDC and the health department, they developed friendships and gained trust of the producers, and that allowed us to get on there. Otherwise, we would have been locked out of these facilities.
Great, thank you. There's also a question, are mink regulated in Utah? Does it require a permit, and are they considered farm animals?
They're not highly regulated here in Utah, but they are considered livestock in Utah. And that goes back to the same trouble that they had, is that they're considered livestock in Utah, but not federally. And that was one of our obstacles that we had to overcome.
Thank you. There's another question. Could you comment on worker education and were workers fit tested for N95 use?
This is Caitlin. I can comment on that. So we've been working very closely with the Utah Department of Health to provide education to all of the farmers on the affected mink farms, including they were able to provide personal protective equipment, including face masks and face shields and protective disposable outerwear to the farmers, and provide training on how to safely put those on and take those off. They are also looking into opportunities to have the farmers pursue fit testing if that's something that they're interested in.
Thank you. And we had one more question come in for Grace. Can you elaborate on SARS-CoV-2 and clinical signs in dogs? Is it still uncertain if a dog can have clinical signs? Do you consider your study helps to answer that question?
Sure. So dogs can have clinical signs. In our investigation, the dogs that did have clinical signs were both mild clinical signs. So it is possible, but again, what we are seeing is that they have, from our investigation, that these were mild clinical signs.
Thank you. Okay, and another question for Dr. Taylor. I think you spoke a little bit to this already, but could you speak more about how the concerns and fears the mink farms had were overcome, and if there were any particular communication strategies or techniques used for that?
Initially, I had very few contacts with this industry, and when I would try to get contact with them, they would say, just come through the Fur Commission and we'll pass it on, which was not an effective way. The biggest thing that honestly changed this was seeing us put some effort into helping them out financially when they're losing that volume of their business in just literally 1 week's time, and they've lost 50% of their breeders and several thousand mink. Having someone come in and just understand that's life-shattering for them, that was what opened up the door for communication. And then I've tried to be completely transparent with these people as the information comes. Caitlin with CDC has shared that information with them. We haven't kept any of that back from them. We certainly wait till it's confirmed and we know what we're presenting, but I think that open communication with them is what opened the door and allowed us to get on and do some further studying there, and is allowing us to do it currently this week as well.
Thank you. We had a question about access to the mink presentation. So the webinar will be posted online after this. And then we will also share, as you can see on the screen, the contact information for the presenters if you'd like to reach out directly with more questions. And there was another question. Can you please elaborate on the carcass disposal of the dead minks?
Yeah, I can. Because we're still waiting on information on how long that virus, there's still a lot of unknown answers as far as how much risk these carcasses possess. And because after we went out onto these farms and saw what they're composting, what they consider to be composting, which really were just piled up mink, we made the decision here in Utah to just have these buried at landfills. So they are taking them in lined dumpsters or trucks, and the landfills, we've contacted each landfill so they understand that as these mink come, they want to bury them immediately, keep predators and scavengers off them, and then disinfecting these vehicles back and forth. So we just felt like right now that was the quickest, easiest way to dispose of these animals and the most safe.
Thank you. We're at the top of the hour. If you have other questions for today's presenters, like I mentioned, we've included their email addresses on this slide, and they're also on the ZOHU Call webpage for today's webinar and in today's email newsletter. So please join us for the next ZOHU Call on February 3rd, 2021, and thank you for your participation. This ends today's webinar.